Sawadee ka, welcome to Thai Law Forum. My name is Vanessa Monley and we are here today with Dr. Pej Alisanant. Thank you so much for joining us here today.
Thank you. Thank you for letting me discuss about this.
Yeah, no problem. Did you just want to give us a brief explanation on your specialty here?
Okay, I'm the radiation oncologist, so I prescribe the radiation to the cancer patient, and mainly for the head and neck cancer, for the gynecologic cancer. Yeah.
What is your stance on medical marijuana?
Yeah, I think it's a hot issue for today because there's so many claims about the therapeutic property of the marijuana. Yeah. But mainly I would like to discuss only about the cancer because there are a lot of claims for the cancer treatment from marijuana and cannabis derivative. But it have very limited evidence that show the benefit of marijuana directly to the cancer treatment. Yeah.
Okay, so there are some studies that claim that marijuana could kill cancer in vitro cells. Do you think these studies are credible?
Yeah, it's because the in vitro is very limited. There are so many studies in vitro that the drugs have the activity on the cancer, but the ratio of the drug that can pass through the clinical trial, through the market distribution, past the FDA is another scenario, because if the drugs can pass only in vitro, it means that less than 3% chance that the drugs can launch in the market in the future. So I think from the in vitro study, we not have the confidence to conclude that the marijuana can kill cancer. Yeah.
Okay, so basically the studies they're not valuable enough to lead to anything at the moment. And earlier in January, there was a story going around that the government had passed a law to grow medicinal marijuana. However, the Prime Minister himself dismissed this story. How do you think the medical community would react if marijuana was legalized in Thailand?
I think it's so many levels about the legalization. I agree about the legalize for the research, for the medical use under specialists. It may be okay because marijuana itself can make people get high. Everyone know that about the recreational, but they have some activities about pain control. So for now, I think it's very limited. But they have another issue, another scenario. If you think about the therapeutic ratio of the marijuana, if it have the property to kill people, we know marijuana more than 100 years. Yeah. Why drugs company didn't launch it as a drugs? I think because it's maybe have some not good enough or have some limitation about the research. So for now, I think we still cannot conclude that marijuana can kill many diseases, but we can use some under specialists. Yeah.
So do you think medical marijuana would be valuable as a pain medication?
Yeah, let's say it's so many arguments and two sides of doctor. One believe, another not believe in, because for now we have the morphine. Morphine also have the pain control property, and also can use in cancer very well because we know the dose, we familiar with it, and we also can adjust the dose by doctor for a long time, so we know morphine very well. But about the marijuana, we don't know the dose, we don't know how to use it, what is the side effect and limitation. So it's another issue. I think we're going on to evaluate how much dose that we have to give to the patient and how to adjust the dose.
So for countries such as the US who are starting to legalize medical marijuana, do you think you could take some studies from their medical community and apply it here in Thailand?
Yeah, I also follow the report about the medical marijuana use and recreational use in the USA because it's legalized for about maybe 6 years for now. Yeah. So they have so many reports about good and bad for the society, for the user. So I think we can translate the data from the USA to Thailand. But I think in Thai people didn't know much about the pro and con of the marijuana. And for now, the main press trend to bias to say only the good things of the marijuana, but the bad side of the marijuana is very less expressed by the press or the governor or the officer. Yeah.
So you think there needs to be more education on both sides of the use of medical marijuana. So basically, you're saying that the press and the government have been so pro-marijuana, but are you advocating to just be wary that we still need to research more into the negative sides of marijuana?
Yeah. I think we have to wait. And the government have to put more manpower and money about the research. And I think if the result from the research coming back that marijuana have so many effect on the health, maybe good or bad, we can use the data to translate into the medical service. Yeah, I think it's okay to start intensive research on medical marijuana. Yeah.
Okay, so Dr. Alisanant, you provided me a study here earlier today. Did you just want to explain what this case study was about?
Yeah, this one is a FDA warning letter in the USA about the claim from the company that claim about the marijuana derivative that can cure cancer. So it's misleading the society. So it lets somebody think about that marijuana can cure their cancer. But for now, we know that only activity on cancer cell in vitro was proved that, but in the cancer patient, real patient, we didn't know the side effect and didn't know the efficacy. So we should beware about the overclaim of the unknown activity of the marijuana about cancer.
And is there anything else you would like to further discuss about using marijuana for medical purposes?
I think for now we have a great opportunity about the marijuana because the marijuana is a traditional plant in Thailand, I think, and it can grow easily in Thailand. So if we know about the therapeutic property of the marijuana more and more, I think we can use it under the medical license or traditional doctors, something like that.
And for those of you tuning in, we hope to see you soon. ขอบคุณค่ะ